So many of you have questions, I'm sure, about these potential side effects that you're learning about online. I think they're very minimal. Not only, I should say, in my own experience, but what we've seen with our patients. Some people do experience some gastro side effects like a little nausea, burping, potentially some constipation. But when we're talking about nausea, most people experience what we know as women to be morning sickness. So it's just maybe 30 seconds or so of that feeling, and then it tends to go away. Where I see that this is happening the most is on the first dose, when you first try semaglutide, and then also when you titrate up to the next level. So one way that we overcome that here at SmartMED is instead of going up to a full next step on a titration, sometimes if the patient seems like they're worried about experiencing some of these side effects, we'll take that first shot and just go a half of the way up, so just a baby step so that your body can get used to it before we take you all the way up to the next step. Make sure that wherever you're going, you always report any side effects to your provider. Because, for example, if you tell us that you're feeling nauseous on a specific dose, we're going to ask some follow-up questions like, are you eating enough? Are you drinking enough? We're going to find out if maybe the dose is too high, and then we're going to begin to pull back a little bit until you start not experiencing the nausea, and then push forward again as needed. So ensure that you're sharing exactly how you feel, which is another reason why we want our patients to come in at least once a month, and always keep in contact with us throughout the month if you do decide to take the medication with you, and tell us how you're feeling.